we're focusing on select all that apply, and we're looking for risk factors, signs and symptoms, education, and concepts. These are the only 4 ways that I want you to look at for select all that apply. Using the method, start with the last part first. Which of the following signs and symptoms, all right, boom, right there, right? Signs and symptoms already given to you, could suggest that the patient may be experiencing abuse. Another abuse question, right? With abuse, again, we're so adamant because of what's been happening, right? Or what happened, or what is continuing to happen, or what we're worried about. So we got a home health nurse is visiting an 85-year-old patient who lives with their adult son. The nurse notices signs that may indicate elderly abuse. So what are we looking for here? Signs and symptoms of elderly abuse. Elderly abuse. So not just regular abuse, but elderly abuse, right? Elderly abuse. So again, we start with the bottom and we make a decision. If the patient is well groomed and in high spirits during the nurse's visit, are we worried about elderly abuse? No, that's actually what we want, especially if they're living with a family member. The patient seems overly medicated and drowsy during each visit. If this individual is being abused and they're trying to, the caretaker is trying to hide it, what do you think they're going to do? Up the dosage on their medicine? So they're a little bit loopy, so they don't talk, so they're out of it. Yeah. So that would be a sign or a symptom that this person is being abused. So again, we're doing signs and symptoms as our select all that apply. Inconsistent stories between the patient and the caregiver about injuries. Yeah. Well, why do you have this mark on your forearm? Well, I think she, my mother or whatever, this situation looks like mother-son. I don't know. I think maybe she grabbed herself, or, she bumped into something on her ribs. But in reality, it could be being grabbed or being hit, right? Oh, she ran into something, whatever it is. But inconsistent stories. A refrigerator full of fresh food and supplies. Absolutely not. That's pretty easy. Gimme. How about the presence of bed sores in various stages of healing? Yeah. Why? Why are bed sores in different stages of healing? What does that indicate to me? Neglect. Yeah. They're not being moved or taken or get it repositioned or walked or whatever it is, right? It's neglect. And unexplained bruises or marks on the body. Again, this goes right back to the inconsistent stories. But now look at this. When I do questions, if you notice, I don't just tell you that that's the right answer. I tell you why. Why, if somebody seems overly medicated, why would they be overly medicated? We want to hush them. That's what the son is trying to do. So answering the question is great. You go through a Q bank and you answer and you're like, oh, I got them all right. But can you tell me why? Can you tell me why? And those are going to be, that's going to be the way that you're going to get through this. Because if you notice all the students that we interview, if you go onto our YouTube or our podcast, everything is about why. And if you can't tell me why, then you're memorizing. All you're doing is you're telling me this is what it is, and I really can't explain it past that, right? So bed sores. I see a lot of people asking about bed sores. Why are bed sores in various stages of healing? So let's just say that I was to keep this 85-year-old on their back and they got a bed sore near their sacrum. But then they moved and then they got a bed sore on their malleolus, right? The outside of the ankle. And then then they moved again, and then they got it on their hip or on their elbow. Do you think that if a person was being taken care of properly, that they should be laying on one position for a very long time? No. Which means that they're not being walked, they're not being repositioned, they're being neglected, right? They're not being rotated, however you want to say it. So again, it's neglect. It's neglect. Make sense with the various stages of healing? Cool. So we got 1, 2, 4, and 5. 1, 2, 4, and 5, right? So again, very common elderly abuse